My name is Dr. Kaitlyn Iselborn. I am a doctor of physical therapy and I am the DPT here at Sports Recovery Annex. I perform all of the injury evaluations here. I am the assistant medical director here, and I'll also treat a handful of patients as well under my care. The profession of physical therapy as a whole has evolved a lot over the past 10, 20 years. The profession went from requiring you to have a bachelor's degree to then a master's degree and now a doctorate. So with having that title of a doctor, our education does require us to learn a great deal of diagnostic skills, manual skills, different things that allows us to work with patients and be able to really dive in and figure out what exactly is wrong with them and figure out the best course of treatment for them. A typical evaluation would be, hey, if someone's calling in and they have shoulder pain or they did something at practice and I don't know what's wrong, but I'm having this pain in my shoulder. We would perform a thorough evaluation, so we would be looking at range of motion measurements, strength measurements, looking at mobility of the joint, looking at things above and below the joint, figuring out, is it coming from that area or is it coming from somewhere else, and that's just where they're feeling the pain. So we really dive in and we look at all aspects of the upper extremity in general. The athlete will then be seen by athletic trainers, and the athletic trainers will put together a course of treatment for them. And they'll be performing, a lot of the tools that we have in the Annex, whether it's cupping and Graston, some stretching, whatever the trainer feels is appropriate on that particular day when they see them. After they've completed that course of treatment and course of care with that trainer, we'll reassess and either, hey, they're great and they're better, and now we're looking at more of a maintenance plan and that we want to prevent injury, or do we need to go a little bit deeper and we need to treat a little bit further to achieve the full results. If you are injured, or you're wondering if you are injured, or if it's just tightness or soreness from practice or from just everyday life, call the Annex. We go ahead and take a detailed history of, hey, what's going on? So they'll figure out, hey, I need to be seen by the DPT and by our doctor of physical therapy, and you need a full evaluation. When you come in, like I said before, we'll do that detailed evaluation, figure out what's going on.